Radiation in Medicine. The Applications. By Assistant Professor of Medical Physics, Dr. Al-Arif. Application of radiation in medicine. Radiation offers extraordinary benefits for the diagnosis of a wide range of diseases, from broken bones to heart disease. It is also used for treating some types of cancer and test the function of some organs. X-rays, gamma rays, and other forms of ionizing radiation are used to diagnose and treat some medical conditions. This can be in the form of radiation that penetrates from outside the body, or radioactive particles that are swallowed or inserted into the body. Radiotherapy. Treatment of cancer. Cancer cells do not exhibit the regulating mechanism called contact inhibition, a mechanism through which cells detect their neighbors and stop dividing when a certain density is reached. Thus cancer cells multiply in an unregulated manner independent of normal control mechanisms. If this occurs in an organ such as the liver, kidney, lung or brain, then a solid mass will result and damage the organ. The recovery of the malignant tissues from radiation is less than that for normal tissue. This makes it more affected by radiation than normal tissue and therefore can be treated by radiation if they have not spread throughout the body and are not surrounded by critical tissue that is especially sensitive to radiation, such as the spinal cord. Cancer treatment often involves one or a combination of surgery, radiotherapy, chemotherapy, hormone therapy or biologic immunotherapy. These conventional methods of treatment aim to kill cancer cells, but at the same time it kills some healthy cells as well. Radiotherapy procedure aims to increase damage to tumor tissue by delivering high energy to the tumor with a minimum risk to normal surrounding tissue. Radiotherapy is accomplished using one of the following procedures. 1. External beam therapy. It aims to kill cancerous cells by directing high-energy radiation beam at the tumor site for a few minutes a day or a week for about 6 weeks, depending on the type of radiation used in malignancy. This can be achieved by a. Directing radiation beam from different angles. Choosing different angles to direct radiation beam to the cancer area aims to reduce radiation effect to normal tissue in the path of radiation while delivering maximum radiation dose to tumor area, as in the figure B. Shielding normal tissue. A proper shielding to normal tissue around the cancerous cells enable us to deliver high radiation dose to the area without affecting surrounding normal tissues. Recently a multi-leaf collimator, MLC, driven by sophisticated computer has been used to shape the radiation beam to the cancer area exactly, as in the figure. 2. Brachytherapy. Brachytherapy involves placing a radioactive material directly inside or next to the cancer inside the body. Brachytherapy, also called internal radiation therapy, it allows a physician to use a higher total dose of radiation to treat a smaller area and in a very shorter time. Brachytherapy may be either temporary or permanent. In temporary brachytherapy, a highly radioactive material is placed inside a catheter or slender tube for a specific amount of time and then withdrawn. Permanent brachytherapy, also called seed implantation, involves placing radioactive seeds or pellets, about the size of a grain of rice, in or near the tumor and leaving them there permanently, as in the figure. 3. Unsealed source. Unsealed sources of radioactivity have been used for therapy for over 60 years. They are usually administered in liquid form orally, by intravenous infusion or by direct injection into tumors or body cavities. Capsules containing radioactive iodine are also frequently given orally, as in the figure. The term targeted radionuclide therapy is when the activity is preferentially accumulated in the tumor either due to direct administration or by selective uptake of the radiopharmaceutical due to biological or chemical processes. Nuclear medicine. The practice of nuclear medicine includes both diagnostic and therapeutic techniques. Most of the procedures are related to organ imaging using internally distributed radioactive material. There are also diagnostic techniques which quantitatively measure physiologic function, such as thyroid radioiodine uptake or gastric emptying time. In nuclear imaging, the photon source is the patient body itself, so the beam is radiating outward from the site in which the radiopharmaceutical is localized inside the body. Anger camera. The standard detector system for nuclear medicine is a scintillation camera which uses a large sodium iodine crystal to convert the energy of gamma photon into a flash of light that is detected by a photomultiplier tube arret. The collimator between the patient and the scintillating crystal will record only primary photons moving directly from the organ to the crystal. A diagram for the scintillation anger camera diagram. Using radiopharmaceuticals, two important factors in using the radiopharmaceutical material must be considered. The first is the ability to detect the radioactive material externally and who the radiopharmaceutical will be localized. It is absolutely necessary to have a radiopharmaceutical which precisely localizes the radioactivity to the organ and the physiologic function that you want to study. The gamma photon emission from the radioactive isotope must be an appropriate energy for the instrumentation scintillation camera. One of the application of radiopharmaceuticals is in thyroid function scan. The element technetium is chemically very similar to iodine and it is actively localized in the thyroid gland. Normal or abnormal intake of technetium gives idea about thyroid function. The image in the following figure shows a normal and hypofunctional scan in the right lower lobe which corresponds in position to a palpable nodule. The image in the following figure shows a normal and hypofunctional scan in the right lower lobe which corresponds in position to a palpable nodule.